Welcome back to this next video in which we are studying headaches. Okay, so we're currently in the process of discussing the pathophysiology underlying cluster headache. So let me begin this video by summarising where we have got to in this story so far and signposting for you where we're going with this story. So, what have we seen so far? So we have seen so far that cluster headache is the name for the disorder where you are susceptible to suffering from cluster headaches. And we've seen that what this corresponds to is a disorder of the hypothalamus, where the hypothalamus at certain times of the year and at certain times of the day, at those certain times of the year, will generate a hyperactivity phenomenon on one side. And this hyperactivity phenomenon may be very similar to epilepsy occurring in one side of the hypothalamus. And it is this hyperactivity phenomenon which can last between 15 minutes and 3 hours, which is then believed to generate the cluster headache. So, in this picture here, I have drawn the hyperactivity phenomenon in pink here as this pink sparkle, and we're imagining that it is occurring on the left side of the hypothalamus here. Now, we have discussed how this is actually going to give rise to the headache of a cluster headache. And we've discussed the fact that if it occurs on the left side of the hypothalamus, it's going to give rise to a left-sided cluster headache, whereas if it occurs on the right side of the hypothalamus, it's going to give rise to a right-sided cluster headache. So how do we believe that this hyperactivity phenomenon occurring in the left side of the hypothalamus then will give rise to a left-sided cluster headache? Well, we believe that somehow the hyperactivity up here in the left side of the hypothalamus is capable of having an effect on the ipsilateral, in this case the left-sided, trigeminal-cervical complex. Indeed, specifically, we think it's capable of activating second-order neurons in the ipsilateral trigeminocervical complex, specifically those second-order neurons that would have been synapsed onto by primary nociceptive afferents that innervate peripheral tissues in the frontal region of the left side of the head, the periorbital region, and the temporal region, which would therefore, if we activated the second-order neurons that were innervated by those primary nociceptive afferents, it would send, obviously, a signal up to the contralateral thalamus, which would then, the third-order neuron there, would send it up to the contralateral primary somatosensory cortex, and that would give rise to the phenomenon of feeling pain in the left-sided frontal, periorbital, and temporal region. Okay, so we believe that the hyperactivity phenomenon is capable of bypassing the peripheral nociceptors and the meningeal nociceptors by directly activating the second-order neurons in the ipsilateral trigeminocervical complex to itself. And of course, this hyperactivity phenomenon is capable of activating those second-order neurons to fire at a fantastic great rate, and therefore is capable of causing the sensation of really, really severe pain that is described as though someone is stabbing your eye with a knife. So, that's where we believe that the headache in a cluster headache actually comes from the hyperactivity phenomenon on one side of the hypothalamus activating the ipsilateral second-order neurons that have primary neurons from the frontal, temporal, and periorbital regions synapsing onto them. It activates those, and it activates them to fire, and therefore bypasses the peripheral primary neurons, and therefore is capable of generating that headache that will last between 15 minutes and 3 hours, because that's how long the hyperactivity lasts for. We then turned on to trying to understand the accompanying symptoms of a cluster headache. So we know where the nausea and vomiting comes from because that's the same mechanism as we've seen in tension-type headaches and indeed also with migraine headaches. We understand why there's probably not going to be meningeal symptoms because remember, to get the meningeal symptoms, you actually have to activate the meningeal nociceptors. This doesn't result in the activation of the meningeal nociceptors. It bypasses meningeal nociceptors. It activates second-order neurons in the trigeminocervical complex directly to trigger the sensation of pain. Right, so what we have come on to is trying to understand the autonomic symptoms that accompany the cluster headache. So remember, when you're having a cluster headache on one side, and let's take, for example, a left-sided cluster headache, you can also get accompanying autonomic symptoms on that left-hand side, and the 5 major accompanying autonomic symptoms that you can get are ptosis, which is a droopy eyelid, meiosis, a constricted pupil on that side, lacrimation, crying on that left-hand side, a red eye on that left-hand side, and also rhinorrhea on the left-hand side because of the increased nasal mucus production. Now, we've discussed that what these autonomic symptoms boil down to is overactivation of the parasympathetic nervous system innervation to the eye, the lacrimal gland, and the nasal cavity, which will produce the meiosis, it will produce the lacrimation, it will produce the red eye, and it will produce the rhinorrhea, and too little sympathetic innervation to the eye, which will produce the ptosis and also will help to produce the meiosis as well. So, we are now trying to explore how this could work, and to understand this as best we can, we need to go into some background anatomy of the parasympathetic and sympathetic nervous systems. So what we have started with is an example of a parasympathetic nucleus in the brainstem, known namely the Edinger-Westphal nuclei. And these nuclei are behind the oculomotor nuclei on either side of the rostral midbrain, like so. And these nuclei contain preganglionic parasympathetic nervous system fibers that will send their axons out with the ipsilateral oculomotor nerve, and they will synapse on postganglionic parasympathetic nervous system fibers in the ciliary ganglion. So, of course, the left oculomotor nerve will go into the left orbital cavity, and the right oculomotor nerve will go into the right orbital cavity. So on the left-hand side, it'll go into the left orbital cavity, and then these preganglionic parasympathetic fibers will synapse onto postganglionic parasympathetic nervous system fibers in the left ciliary ganglion. Then the postganglionic parasympathetic nervous system fibers, they'll send their axons in through the short ciliary nerves into the eyeball to innervate the sphincter pupillae muscles and the ciliaris muscles. The one that's important to us is the sphincter pupillae muscle, because when that contracts, that will cause meiosis, one of the major things that's going to cause meiosis in a cluster headache. So, what's going to happen then, putting it all together, when you get the hyperactivity on the left-hand side, somehow this must activate the left-sided Edinger-Westphal nucleus to produce left-sided meiosis in the way that we've discussed. Now, I cannot give you the pathway by which the hypothalamus hyperactivity actually manages to activate this left-sided Edinger-Westphal nucleus. What I will say to you is that the hypothalamus is an ancient, evolutionarily ancient portion of the brain which controls a lot of evolutionary ancient functions of the nervous system. The autonomic nervous system is an evolutionarily ancient part of the nervous system. So we know that the hypothalamus does indeed control a lot of the autonomic nervous system. So it is very plausible that there are links between the hypothalamus and the ipsilateral Edinger-Westphal nucleus, and indeed other nuclei of the parasympathetic nervous system, and places where the preganglionic sympathetic fibers are, which we'll see later on in the T1 to L2 portions of the spine. But we'll come back onto that. Okay, so when you get this hyperactivity in the left side of the hypothalamus, it somehow leads to activation of the left-sided Edinger-Westphal nucleus. Remember, left side of the hypothalamus controls the left side of the autonomic nervous system, right side of the hypothalamus controls right side of the autonomic nervous system. The hypothalamus doesn't have the contralateral thing that the cerebral hemispheres do. It's like the cerebellum in that regards. Right, so where are we now going to go? Well, this explains meiosis. That's all we've managed to explain so far. I now want to explain lacrimation to you. I want to explain the red eye to you. I want to explain the rhinorrhea to you. And for this, I need to show you another parasympathetic nervous system nucleus where there are preganglionic parasympathetic fibers. And that nucleus that I need to show you is the superior salivatory nucleus. Now, this is in the pons, and the fibers from that nucleus come out in the facial nerve. So we need to discuss the anatomy of another cranial nerve here. So more background anatomy then. So I'll just put this here. We are now going to discuss the facial nerves. and the facial nerves are cranial nerve number 7s. So CN, and then there is the Roman numeral for cranial nerve number 7. Right, so the parasympathetic nucleus that throws its fibers into the facial nerve is called the superior salivatory nucleus. I might as well write that down straight away. Again, of course, there are 2 of them, one on either side. So we are now going to discuss the superior salivatory nuclei, and for short, I will abbreviate the superior salivatory nuclei down to the SSNs. Okay, right. So, where are the superior salivatory nuclei? Well, they are behind the facial nerve nuclei. So I suppose I need to just give a little bit of motivational speech about the facial nerves. Facial nerves, cranial nerve number 7s, they are very, very important nerves. The trigeminal nerves that we studied long, long ago, they were the major sensory nerves of the face and, the face. The facial nerves are the major motor nerves of the face. They are going to contain a lot of the fibers of alpha motor neurons that are going out to innervate muscles of the face, excluding, of course, the muscles of mastication, which were innervated by the trigeminal nerve, specifically the mandibular division of the trigeminal nerve. So, the superior salivatory nuclei, they're actually going to turn out to be behind a nucleus called the facial nerve nucleus, which contains the cell bodies of the alpha motor neurons that are going to innervate muscles all over the facial region. Okay, so we're going to see the facial nerve nuclei and then the superior salivatory nuclei. And what level of the brainstem are these in? They're in the pons, but they're not in a section of the pons we've ever drawn before. Previously, when we've drawn the pons, we've gone through right at the middle here, and we've seen things like the principal sensory nucleus of the trigeminal nerve, the motor nucleus of the trigeminal nerve, even the locus coeruleus as we saw. I now want to go further down. I want to go down to here. Not quite at the bottom. I don't want to go down to the bottom, but I want to go just below the middle, this sort of section, more caudal than we've ever been previously. I want to see the nucleus that's underneath the motor nucleus of the trigeminal nerve, which is indeed the facial nerve nucleus. And then we'll see where the superior salivatory nuclei are. So, at that more caudal level, we will still have the middle cerebellar peduncles at the back. So, let me draw this here. So, we'll start off by putting the middle cerebellar peduncles in. So, there is the right middle cerebellar peduncle, and here is the left middle cerebellar peduncle, and then we come forward, and here is the front of the pons there. And let me just erase that horrible annoying mark that I've managed to put there. Okay, excellent. Okay, so here's my basic picture of this more caudal section of the pons, so I don't need to label middle cerebellar peduncles, we know those. Right, other things that we can put on here, of course, are the corticospinal tracts. They are still running through the front here, so we'll start by putting those on. The right and left corticospinal tracts here, running through the front of the pons just as they were at the more rostral section, and of course also in this front portion here we'll also have the pontine nuclei, and we'll have pontocerebellar fibres crossing over from the pontine nuclei. All of that will still be going on here. We're not interested in that, we're interested in what's further back. So let's put in the medial lemnisci, which split the front of the pons apart from the rest of it, the more posterior portions. So here in red, these are the medial lemnisci. Then we can put on the trigeminothalamic tracts. We'll put those in green here. And then, of course, we can put on the spinothalamic tracts, which are more lateral compared to the medial lemnisci. Behind this, of course, we are going to have the beginning of the spinal nucleus of the trigeminal nerve. Remember the section that we have gone through of the pons. We are going through more caudally. When we went through in the middle, we went through the principal sensory nucleus of the trigeminal nerve. Now we're going through lower down. We will be cutting through the very, very top portion of the spinal nucleus of the trigeminal nerve. So let's put this here. So here is the spinal nucleus of the trigeminal nerve, here in vivid purple as we've always had it. And then, of course, lateral to the spinal nucleus of the trigeminal nerve, what will you have? The spinal tract of the trigeminal nerve in white there. Then, of course, we can put in the reticular formation, the pontine reticular formation, which is all of this portion at the back here before we get to the middle cerebellar peduncles, and then behind here we'll have the fourth ventricle. So I hope you are familiar with all of these structures and are perfectly happy that I've put those in. We've seen those all before, and you should have been able to work this out for yourself. Now, the new structures that we're going to put in are the facial nerve nuclei and also the superior salivatory nuclei. Now, the facial nerve nuclei are going to be just underneath where the motor nuclei of the trigeminal nerves were, and that's in these positions just medial to the spinal nuclei of the trigeminal nerves. So I'll put these in here in green. So those are the facial nerve nuclei. And remember the motor nuclei of the trigeminal nerves. When we went through right in the middle, we saw the principal sensory nucleus of the trigeminal nerve, and then just medial to the principal sensory nucleus of the trigeminal nerve was the motor nucleus of the trigeminal nerve. So therefore, when we've gone underneath, we are now seeing the spinal nucleus of the trigeminal nerve, and next to it, we're not seeing anymore the motor nucleus of the trigeminal nerve, but we're seeing the facial nerve nucleus. So I think I should probably label that new one up. So in green there, that is the facial nerve nucleus, and because we've got two of them, I will of course call them the facial nerve nuclei. Okay, right, and I've managed to put in another horrible blob there, which I'll just get rid of. Right, so onwards. So where do we want to go next? We want to see the superior salivatory nuclei, and then we'll discuss the anatomy of the facial nerves. So the superior salivatory nuclei, they are at this same level of the pons, and they are just behind the facial nerve nuclei. So they are in these positions that I'm now putting in here in red. So those are representing the superior salivatory nuclei just behind the facial nerve nuclei here. Okay, so let me tell you precisely, make this absolutely crystal clear what each of these nuclei contains. I've already said it pretty much, but I'm going to say it again just to make sure it's absolutely clear. The facial nerve nuclei, they contain the cell bodies of the multipolar alpha motor neurons that are going to innervate most of the muscles of the face, that will send their axons out in the facial nerve. And of course we have a left facial nucleus and a right facial nucleus. The left facial nucleus will serve the left side of the face, the right facial nucleus will serve the right side of the face. Behind the facial nuclei, we have the superior salivatory nuclei, which will contain preganglionic parasympathetic fibers. So both of these nuclei here are parasympathetic nervous system fibers, no sympathetic fibers here. They will contain preganglionic parasympathetic fibers that are going to synapse onto postganglionic parasympathetic nervous system fibers that will innervate the ipsilateral conjunctival blood vessels, and therefore will be responsible for dilating them and causing red eye. They will also innervate the ipsilateral lacrimal gland and the ipsilateral nasal cavity to increase its mucus secretion, which is why, of course, we are very interested in these nuclei whilst we're discussing cluster headaches. Okay, so let's now discuss the anatomy of the facial nerves then. So, again, the preganglionic parasympathetic fibers in the superior salivatory nuclei, they will be multipolar nerves. So both of these types of neurons are multipolar. They're going to send their axons out in facial nerves, and the facial nerves will come off at the junction between the pons and the medulla. So these send their fibers off, like so, downwards slightly, because they're in a higher section of the pons than where the facial nerves come off. And the facial nerves come off in this region. So let me just mark it on here, and I'll get a thicker pen for this. So they come off in this position here. This, of course, is the left one because we're looking from the left-hand side, but there would be a right one that I'll show like that. It doesn't work as well because I can't obviously see the right-hand side. Now, so it comes off at the junction between the pons and the medulla, and it actually comes off the portion of the medulla just above the pyramid. So let me mark the pyramid on here. So in purple here, this can be the left-sided, sorry, not the pyramid, the inferior olive. It comes off above the left-sided inferior olive. That's what this is representing, not the pyramid. The pyramid is here. The abducent nerves come off above the pyramids. The facial nerve comes off just above the inferior olive. So here is the left-sided inferior olive with the left facial nerve coming off above the left inferior olive, and the right facial nerve will come off just above the right inferior olive. Right, okay, so these are just nerves now. They are loads and loads of axons all running together. And these axons are the axons of the preganglionic parasympathetic fibers from the ipsilateral superior salivatory nucleus and the axons of the alpha motor neurons from the ipsilateral facial nerve nucleus. Excellent. So of course they're now coming off the surface of the brain, so they'll have to penetrate through the pia mater. They'll then temporarily be in the subarachnoid space. Now where are the facial nerves going to go? How are they going to get out of the cranial cavity? Well, they actually go into the internal acoustic meatus, which is a hole into the petrous portion of the temporal bone. The hole that also cranial nerve number 8 goes into, the vestibulocochlear nerve. However, it's not really surprising that the vestibulocochlear nerve goes into the internal acoustic meatus, because of course inside of the petrous portion of the temporal bone is the labyrinth, which contains the vestibular and the auditory apparatus. So it's not surprising at all that that goes in there. It's more surprising that the facial nerve goes into it, but it's going to go through the petrous portion of the temporal bone and come out in a hole underneath the skull, in the bottom portion of the temporal bone, called the stylomastoid foramen, that I'll show you in just a moment. So, oh, that's bad, I haven't gone back to the thinner pen. Let me just get the thinner pen. So, in the petrous portion of the temporal bone, in this position here then, there is a hole called the internal acoustic meatus. So I'll remind you of this. So this is the internal acoustic meatus. And this is the hole into which the facial nerves are going to go. And of course, to get into this hole, which is a hole into the inside of the petrous portion of the temporal bone, they're going to have to penetrate through the outer layers of the meninges. So they penetrate through the outer layers of the meninges, so they're no longer in the subarachnoid space, and they then enter the internal acoustic meatus here. And the left-sided one will of course enter the left internal acoustic meatus, and the right-sided one will enter the right internal acoustic meatus. Then what happens is they go through the petrous portion of the temporal bone, and then through a little canal, and then they make their way to exit from the temporal bone by a hole that is on the bottom of the temporal bone called the stylomastoid foramen. And to show you this, I have brought back a picture that we drew long ago, because it's such a good picture. It is a bit crowded, but I like this picture, and I didn't want to have to draw this picture all over again, so I brought this picture back. So, I'm now going to show you where the facial nerve comes out on this picture. So remember, here is the styloid process, here is the mastoid process. All of this bone here is the temporal bone. This is the external acoustic meatus, which goes in. If you were a little man and could go in this channel, this goes into the petrous portion of the temporal bone, and then at the end of it will be the tympanic membrane. And if you could puncture through the tympanic membrane, you'd go into the middle ear cavity, which is again inside of the petrous portion of the temporal bone. So this is where the petrous portion of the temporal bone is. The facial nerve has gone through this bone, and it's now going to come out a hole at the bottom of the petrous portion of the temporal bone that is in between the styloid process and the mastoid process, and is therefore called the stylomastoid foramen. So of course foramen just means hole, so stylomastoid is to do with the fact that it's in between the styloid process and the mastoid process. So here comes the facial nerve out here, and I've got my thicker pen back. So this is cranial nerve number 7 on the left-hand side, of course. So it journeys through the petrous portion of the temporal bone, and most of it comes now out the bottom of the petrous portion of the temporal bone through the stylomastoid foramen. As we'll discuss, the bit that's really important to us, which is the parasympathetic axons, they do not come out here, but the alpha motor neurons that are going to supply muscles of the face, they do come out here. So I'm just doing this story now for a bit of background here. This is not the bit that's actually important to us. The important bit to us is where the parasympathetic fiber's gone, and they are not coming out here now. They will have gone off somewhere else, and we'll come to that in just a moment. So then, once it has come out the bottom of the stylomastoid foramen, it then splits into 6 major different branches, which I'll try and draw on here. I'm not going to draw them fully, otherwise it'll just ruin the picture, but it's going to split into 6 different branches, and then I need the thick pen. So here is one of those branches, then here is another branch, okay, here's another branch, and I'll tell you the names of these branches in just a moment, and then another branch that splits into these 6 branches. 1, 2, 3, 4, 5, 6. And I haven't drawn them fully, they go on and on like this. Okay, so what are the names for this? This one that's going up here, that is called the temporal branch of the facial nerve. So I'll write down their names in this position here. So the first one at the top there is called the temporal branch, and I'll just get the thinner pen back. Oops. So temporal branch is the top one, and then the one underneath that is the zygomatic branch, and there is an acronym for remembering the first 5, the 5 that are going forwards, and it is 2 zebras bit my cat. 2 is for the temporal branch, zebras is for the zygomatic branch, bit is the middle one, that's the buccal branch of the facial nerve, not to be confused with the buccal nerve. The buccal nerve, which is not that one, sorry, the one that is by, that's the inferior alveolar nerve, I think there. But the buccal nerve was one of these branches that I had here it's this one here that gives off all the branches to the muscles of mastication and then innervates the tissue of the lower cheek. The buccal branch of the facial nerve is not called the buccal nerve, it's called the buccal branch of the facial nerve. So do not confuse the buccal branch of the facial nerve with the buccal nerve, which is a branch of the mandibular nerve. Okay, so 2 zebras bit my is mandibular. So that's the 4th branch. So I'll just point to that one. So that's this one here, coming down to the mandible here. And remember, these are not sensory nerves, these are motor nerves. They'll be innervating all the muscles, apart from the muscles of mastication, in the regions where they're going. And there are loads of muscles that we haven't gone into because it's too much. Okay, but there are loads of muscles in the facial region that they're going to be innervating. And then the final one, cat, is cervical, and this will go down into the upper portion of the neck, as I'm sort of showing here. So this is the cervical one. So temporal branch of the facial nerve, zygomatic branch of the facial nerve, buccal branch of the facial nerve, mandibular branch of the facial nerve, and cervical branch of the facial nerve. 2 zebras bit my cat. And then this final one, the acronym doesn't work for that. Or actually, no, it's not an acronym really, it's a mnemonic rather than an acronym. But this final branch, the 6th branch of the facial nerve, this one isn't featured in the mnemonic, and this one is the posterior auricular branch of the facial nerve. So that one going behind the ear, of course, you can see here is the external acoustic meatus, so it's going behind that. That's called the posterior auricular branch of the facial nerve. Okay, so those are the 6 final branches of the facial nerve, and they're going to supply motor innervation to the face, and indeed not just the face, because we've also got this posterior auricular nerve that will go backwards. So it supplies motor innervation to the head on the left-hand side in the case of the left facial nerve, and on the right-hand side in the case of the right facial nerve. Alright. So that's where the alpha motor neurons that have their cell bodies in the motor nucleus on the left-hand side of their small caudal section of the pons are going to send their axons to. Now we want to go back to the superior salivatory nucleus that has the preganglionic parasympathetic nervous system fibers in. How are they going to travel? Well, as I say, they initially go into the facial nerve and they follow the facial nerve into the internal acoustic meatus, but then they're going to branch off a branch whilst it's going through the petrous portion of the temporal bone, and this branch is called the greater petrosal nerve. So let me go into this picture here. This is probably the best one to show this on. So, to do this, allow me to just make the petrous portion of the temporal bone a little bit thicker so that it's not just represented by a line. So this now is all representing the petrous portion of the temporal bone. I've just made it actually have a thickness here rather than it being just represented by a line. Okay, so it's not really quite that thick, it's out of proportionally thick in this picture, but just for the sake of having a picture, here we go. So here is the facial nerve on the left-hand side. It goes through here and then it will come out the stylomastoid foramen. So it goes through the petrous portion of the temporal bone, and all this while it's in the petrous portion of the temporal bone, and then it will come out the bottom through the stylomastoid foramen. However, there is a major branch that comes off it here, a very important branch that is going to contain the preganglionic parasympathetic nervous system fibres, and that is called the greater Petrosal nerve. And the symmetrical picture here would be true on the other side. I won't draw it on the other side, but it would be exactly symmetrical. So this is the greater Petrosal nerve. Okay, now this is going to come out of the petrous portion of the temporal bone. As I've tried to show here, it comes out into the middle cranial fossa here from the petrous portion of the temporal bone. And to do that, it's going to go for a foramen called the greater Petrosal foramen. In fact, there's two. There's a canal and then there's a foramen. So it's going to go for a canal first called the greater Petrosal canal. So this is the greater Petrosal canal. And then it comes out an opening into that canal, which is a hole in the petrous portion of the temporal bone, which is then called the greater Petrosal foramen. So it goes through the greater Petrosal canal, then comes out the greater Petrosal foramen, and it's then in the middle cranial fossa. Now, these need to get out of the middle cranial fossa. They can't stay in the cranial cavity. They need to go to sites outside of the cranial cavity. So how is it going to get out of the cranial cavity? Well, here's something interesting. It's actually going to go for a foramen, which I believe we have not seen anything else go through yet. And it's going to go through the foramen lacerum, which is, of course, that big foramen just at the base here. So I'll just put on the foramen lacerum. We haven't seen anything go through this foramen, even though it's a massive great foramen, far bigger than any of the other foramina in the middle cranial fossa floor, but hardly anything goes through it, and here is one of the rare examples of something that does go through it, the greater Petrosal nerve. So it comes through the foramen lacerum, which I put in there. So, I don't think actually I need to add anything onto that picture. You can see it just about going into the foramen lacerum, and then it will come out where? It will come out in the infratemporal fossa. Remember, the foramen ovale and the foramen spinosum would be in these positions. I'll just add those on. There's the foramen ovale and there's the foramen spinosum. Those we know come out into the infratemporal fossa. The foramen lacerum also empties into the infratemporal fossa. So back to this picture over here. So here, of course, is the foramen ovale. The foramen lacerum will be in this sort of position, if you like, coming out into the infratemporal fossa. So I'm going to try and put this on. So we can have the foramen lacerum further back in that sort of position there. And then in aquamarine, and I'll draw it thicker, whoops, like so. In aquamarine, here comes my greater Petrosal nerve through the foramen lacerum. Now, where is it going to go next? It's going to get into the pterygopalatine fossa, and this is really the reason I wanted this picture, so that I wouldn't have to draw the pterygopalatine fossa again. It's going to get into the pterygopalatine fossa by going through a canal in the medial pterygoid plate. So remember, we are seeing the lateral pterygoid plate here. However, just inside of the lateral pterygoid plate, there is also the medial pterygoid plate, and I believe this was a picture of the pterygoid plates. So on either wall of the nasal cavity, right at the back of the walls of the nasal cavity, you have the lateral and medial pterygoid plates. So if this was the left side, the left nasal cavity would be here, the nasal septum would be here. Then you'd have the right nasal cavity, and then you'd have the right side pterygoid plates. So on either side you have a lateral pterygoid plate and a medial pterygoid plate. We are seeing the lateral one here, and there is a groove in between the two pterygoid plates. Now, in the roof of the, or actually through the medial pterygoid plate, there is a little canal, and it's very difficult to show this on, but I'll do my best. So in the medial pterygoid plate, at the top of the medial pterygoid plate, remember this is made up of bone, there is going to be a little canal through which you can move through the medial pterygoid plate. And if you move through that to the back, you actually end up in the pterygopalatine fossa. Remember, back here, this is where the pterygopalatine fossa is. It's behind the pterygoid plates. Behind not just the lateral one, but it's deep enough that it's also behind the medial one as well. So, what is this canal then called? This canal is called the pterygoid canal. So in green there, this canal through the medial pterygoid plate, it's called the pterygoid canal. And the greater petrosal nerve is going to go into that pterygoid canal to get into the pterygopalatine fossa. So, aquamarine at the ready then. Here it comes. It's going to go through like this, and we wouldn't be able to see it, but I will put it in anyway. So it's gone through the medial pterygoid plate, the pterygoid canal here. Of course, we're actually showing it going through the lateral pterygoid plate, but behind the lateral pterygoid plate will be the medial pterygoid plate, and it's going to move through the pterygoid canal of the medial pterygoid plate to end up in the pterygopalatine fossa, this space here. And when it's going through the pterygoid canal, it is called the nerve of the pterygoid canal. So the greater petrosal nerve becomes the nerve of the pterygoid canal to move through the pterygoid canal here. Okay, right. So the parasympathetic fibres, preganglionic parasympathetic fibres, they've all now got into the pterygopalatine fossa, and in the pterygopalatine fossa is going to be the ganglion where they are going to synapse onto the postganglionic parasympathetic fibres. So let me draw this in, and I don't want to obscure anything else, so I'll put it here. So here is this ganglion that it's going to enter, and what do you think that ganglion is going to be called? Well, what else would it be called other than the pterygopalatine ganglion? So there is a ganglion in the pterygopalatine fossa, and it's called the pterygopalatine ganglion. And this contains the synapses between the preganglionic parasympathetic fibres from the nerve of the pterygoid canal, which was previously the greater petrosal nerve, and the postganglionic fibres. So really, it contains the synapses between the preganglionic parasympathetic fibres that had their cell bodies in the superior salivatory nucleus on the left-hand side, and the postganglionic parasympathetic fibres. So the question is now, where are these postganglionic parasympathetic fibres going to go? Well, where are they going to innervate? They need to get to the lacrimal gland somehow, they need to get to the blood vessels of the conjunctiva, and they also need to get into the nasal cavity on the left-hand side. Those were the three things I said they're going to innervate. How can they get into the orbital cavity? Through the inferior orbital fissure, which is, remember, it's a fissure that leads between the orbital cavity and the pterygopalatine fossa. Now, they're actually going to hitchhike a ride. They're going to go with the zygomatic nerve, that branch of the maxillary nerve here. So remember, here's the maxillary nerve, it's come through foramen rotundum into the pterygopalatine fossa, and here is the zygomatic nerve, which goes through the inferior orbital fissure and then breaks into the zygomatico-temporal nerve and the zygomatico-facial nerve, which then go into the zygomatico-temporal and the zygomatico-facial foramina, well, firstly canals and then foramina. Okay? It's these postganglionic parasympathetic fibres are going to go into the zygomatic nerve here, and they're then going to end up in the in the orbital cavity here, the bottom part of the orbital cavity. Now, how are they going to get up to the lacrimal gland? Well, to get up to the lacrimal gland, they're now going to move from the zygomatic nerve to the lacrimal nerve. So let me try and add this in on this picture. So, the lacrimal nerve is a nerve we've seen previously. It is a branch of the ophthalmic nerve. So just adding in the ophthalmic nerve on this picture, sort of. Remember, the ophthalmic nerve comes through the superior orbital fissure, and it splits into three major branches. There is the frontal nerve that goes forward and becomes the supratrochlear and the supraorbital nerve. There is the lacrimal nerve that goes laterally over to the lacrimal gland, which will be up here. And there is also then the nasociliary nerve that sort of goes downwards and remains medially like so. Okay, we discussed this long ago and we didn't put it on this picture, we had a separate picture to show it which I haven't copied over. The one that's important to us at this point is the lacrimal nerve, this branch here, okay, which remember goes up to where the lacrimal gland is, and it carries sensory fibres from the lacrimal gland and also surrounding tissue of the lacrimal gland here. So, there is actually a communicating branch which I did not tell you about previously between the zygomatic nerve and the lacrimal nerve, which I'll put in here. Oh, no, it hasn't worked. Let me try again. Here we go. That's better. So this is called the communicating branch between the zygomatic nerve and the lacrimal nerve. So it's got a very big name. We will just write down that it is called the communicating branch, but you should obviously say between the zygomatic nerve and the lacrimal nerve. And this takes postganglionic parasympathetic axons over to the lacrimal nerve. And I've just realised I haven't actually joined them onto the right one. That's embarrassing. Okay, I joined it onto the nasociliary nerve here. This is the lacrimal nerve, so it communicates between the zygomatic nerve and the lacrimal nerve. Then they will run with the rest of the lacrimal nerve to, of course, the lacrimal gland, which I'll put in here. So as this green cloud structure here, that's the way people always draw the lacrimal gland. So, of course, here comes the lacrimal nerve, and one of the major things it's going to innervate is the lacrimal gland, but also the surrounding tissues, including the upper eyelid. So here now comes these postganglionic parasympathetic fibres, and they can go into the lacrimal gland and innervate it. So that's the way that the parasympathetic nervous system innervates the lacrimal gland. This is, of course, what happens on the left-hand side, but the equivalent thing happens on the right-hand side. Now, this is more important than just the innervation to the lacrimal gland. Postganglionic parasympathetic fibres that are also going to innervate blood vessels of the conjunctiva and also the sclera are actually going to come in through the lacrimal nerve. So remember, the lacrimal nerve doesn't just innervate the lacrimal gland, also the surrounding tissues, including the top of the eye, the top of the eye, the superior eyelid, all of this surrounding tissue. Now, including the conjunctiva as well, that lines the undersurface of the eyelid and then the surface of the eyeball. Those tissues, the conjunctiva and the sclera, they're going to have blood vessels in them, and those blood vessels are going to have smooth muscle cells around them, and those smooth muscle cells are going to be innervated by these postganglionic parasympathetic fibres. And when the postganglionic parasympathetic fibres innervate them, when they're activated, it causes relaxation of those smooth muscle cells and then vasodilatation of the blood vessels. So know that these postganglionic parasympathetic fibres, not only are they innervating the lacrimal gland, but this is also where the innervation of the blood vessels in the conjunctiva and also a bit of the sclera of the eye as well, where their blood vessels are innervated from. And when this is activated, when you've got increased parasympathetic output to those blood vessels, that will cause them to vasodilate, and this will give rise to red eye. So actually, this branch here is important in explaining where lacrimation is activated from and also where the red eye is activated from. This innervates those blood vessels of the conjunctiva and the front portion of the sclera, which, if they are getting increased parasympathetic output to them, they will dilate and therefore cause the eye to become red. Okay, so we can justify both lacrimation and red eye by activating these postganglionic parasympathetic fibres that will run in the communicating branch between the zygomatic nerve and the lacrimal nerve there. Okay, right. Then, final thing to explain is how do you get postganglionic parasympathetic fibres getting into the nasal cavity. This requires a final little bit of anatomy then here. Okay, so also off the pterygopalatine ganglion then is going to come a branch called the nasopalatine nerve, and I'll draw this in here. So again, I'm going to go for a thicker pen, and I'm sorry I'm now obscuring the maxillary nerve here. But here is this nasopalatine nerve, drawn there again in aquamarine, so I'll just label that one up. If I can find somewhere to put the label, I'll just go over here for a while. So that nerve is called the nasopalatine nerve. Now this needs to get into the nasal cavity. Now where is the nasal cavity? Think about this. The nasal cavity is just through there, at the back wall of the pterygopalatine fossa here. If I was to chisel through here, I'd surely get into the left nasal cavity. So surely this should be able to easily get into the left nasal cavity, and the answer is yes. There is a foramen that I have not told you about previously, which connects the pterygopalatine fossa with the nasal cavity, and I'll now put this on here in green. So there is a foramen in the back wall of the pterygopalatine fossa as we're looking at it now, so the back wall over there that connects the pterygopalatine fossa to the nasal cavity. And what is that foramen called? That is called the sphenopalatine foramen. So sphenopalatine foramen. So the nasopalatine nerve will go through the sphenopalatine foramen into the nasal cavity, and it will then innervate the nasal epithelium with parasympathetic fibers, and when those are activated, when those postganglionic parasympathetic fibers are activated, they will increase the mucus production by that nasal epithelium, and therefore will lead to rhinorrhea. So, what I have just shown you is how the activation of these preganglionic parasympathetic fibers in the left superior salivatory nucleus will result in left-sided lacrimation, it will result in left-sided red eye, it will result in also left-sided rhinorrhea. The left nasal cavity will produce more mucus. And the equivalent would be true if we activated the right-sided superior salivatory nucleus. Therefore, again, going back down here, what we can therefore conclude is that somehow this hyperactivity in the left hypothalamus, which is going to give rise to a left-sided cluster headache, not only does it somehow activate the left Edinger-Westphal nucleus, but it must also activate, whoops, pointed to the wrong thing, the left-sided superior salivatory nucleus here in red, and that will produce a huge number of those autonomic symptoms. So we've now discussed how we're going to increase the activation of the parasympathetic output to the eye on the ipsilateral side, the lacrimal gland on the ipsilateral side, and the nasal cavity on the ipsilateral side to give rise to 4 out of the 5 autonomic symptoms that I wanted to discuss. In the next video, we will move on to discussing the sympathetic nervous system innervation to the eye, and we'll then have completed up our discussion of how the autonomic symptoms come about of cluster headache. So I'll see you in the next video. We'll have a break here.